I'm in Richmond today because I'm one of the 400,000 Virginians who do not have health insurance. And why? Because even though I work hard as a health care provider, I don't qualify for health care myself, from the medical marketplace nor through the state's Medicaid programs. I came to voice my concerns about it to the General Assembly members who oppose expanding Medicaid, which would give all Virginians access to health insurance.
Back in December, I was hospitalized for 3 days, and now I'm stuck with paying a very high hospital bill. Even though I got discounts from the hospital to help pay the bill, I'm still stuck paying the balance of it.
What were you in the hospital for?
I had a minor stroke right before Christmas. And without medical insurance, I'm not able to continue on with the treatments that I need to have. So I go to the community health center. That's where I get all my checkups from. Right now, I'm having a problem with kidney stones. And without medical insurance, I can't go see a urologist to see how big the kidney stone is.
I had an experience that I sustained an injury in '95 that I ended up with traumatic brain injury. And if it had not been for Medicare and the extensive surgery that I had to have jaw surgery to remove the left side of my bone in my face. I had to have my whole face reconstructed. Also, I had to learn how to walk and talk again. I had to learn how to read and write again. And if it had not been for Medicaid, I wouldn't have had all this done.
My situation is I'm a recent graduate from Hampton University, and if it weren't, well, thank you. And if it weren't for the health care, that my parents have, and that Obama extended the health care age to 26, I would be without health care right now. So, that's how the health care has really helped me. And I have sickle cell, so I go to the hospital all the time.
Well, I have a sister that she has Hep C. And it's greatly impacted her life. She actually just found out that she has cirrhosis, which is caused by the Hep C that's not been treated.
So if she had health insurance, do you think she would have cirrhosis today?
I can't really say that. I don't think so, because she would have gotten treatment.
I have a job, but I missed my enrollment date to get a health insurance, so I got to wait a whole nother year just to enroll into my health insurance, my company. So I caught the flu, and I had an upper respiratory infection, and I went to this fancy hospital in Norfolk, and I was real sick. I felt like I was on my dying bed, and the lady asked me first for like my ID. I had my ID, then the next question was, do you have insurance? And once I said no, they basically put me out the hospital.
So far, right now, I'm in between health care because they don't offer it on my job, and I can't afford the health care that's out here. So I'm trying to find health care, like at Crossover Clinic and different clinics, to try to maintain my blood pressure, because I have high blood pressure, and I had congestive heart failure in 2004.
I've been uninsured. I am one of the 33,000 veterans that have no health coverage, part of the 400,000 Virginians without health coverage.
It affects me and it affects my family, because when my blood pressure go up, I'm not able to work as well as I should, and it's different things that's affecting me and my family, because they're scared of losing me because I could have a stroke or a heart attack, so it affects us all.
Now I have what is called combined mechanism glaucoma. There is no fix to it, and eventually I will go blind. But I also have bills. I have bills that they sent to me right after I had the surgery, but I also trust in the Lord. And see, God says that I'm healed. It says that I'm healed. So I know that I'm healed, but there are medicines that I need to have. And without the health care insurance, I cannot get it. It's $409 a month for the rest of my life. I got a long life ahead of me.
I'm a social worker, and I worked with an agency in child services for 3.5 years. And after I left that agency, looking for more work, I was uninsured for a significant period of time. I had health issues with my back, and had also experienced some secondary trauma from my social work, and wasn't able to access any health care or counseling or anything. Really struggled for a long time.
We're actually paying in billions of dollars a year for health care as part of the Affordable Care Act. And now it's time to bring that money back into Virginia, boost our economy, and give hard-working Virginians the health care coverage they deserve. A lot of these people have paid into it through their lives by being working taxpayers. Over 70%, not over, approximately 70% of Virginians who would be eligible for Medicaid expansion are in a family where someone is working. So this is the working poor we're talking about.
Everybody deserves health care. Health care is not a privilege, it's a right. If you live in the United States of America or anywhere for that matter, being able to take care of yourself it's a right. It's an inalienable right. Regardless of who you are, you should have that option to have health care.
They say that the federal government is $17 trillion in debt and can't afford it. Our comeback to that is we accept in Virginia over $1 billion for transportation funds from the feds, and we accept close to $1 billion in education, as well as millions for courts and police and public safety.
Really, I was uneducated about health insurance, so right now I'm getting more educated about it, and it's good to attend rallies like this and events on health care, because like the neighborhood I'm from, we not being educated on how important health care is, you know what I'm saying, and people not knocking on doors trying to educate us. So, you know, it's a good thing to attend events like this and get educated from people who have been through and going through things similar to me with can't afford health care.
What do you think about the people in the Virginia General Assembly that are not allowing Medicaid expansion?
To be honest, those people have insurance, and so they'll never understand what we're going through. If they ever have to wake up one morning and they lose their job and no longer have medical insurance, I'm quite sure they'd be on our side right now.